Oh, gotcha. That's what your therapist is wondering. But how do they get you? Because we're trying to figure out what they are really thinking. Therapists, you see, are trained to be non-judgmental. They're supposed to be supportive and focused on the job at hand. And that way they are in your presence and very much aware to your presence. One of the things that they are keeping towards the front of their mind is, what patterns am I noticing? See, therapists pay attention to recurring themes in your thoughts, in your emotions, in your behaviors, to try to identify deeper issues. If you come in with one particular issue, doesn't necessarily mean that that issue is what is the real issue at play here. Therapists are trained extremely extensively, and please do go to one if this video just doesn't do it for you. Therapy is something that I've had in my life. I know I have trained at it. And so in a therapeutic way, people that want and need the attention of a therapist are being analysed from the moment they get out of the car even, and maybe the therapist has a few moments off since the last client, and they're looking out the window and they're observing what clothes you're wearing, how your posture is holding, how your expressions are on your face as you think and ruminate about preparing for this session, about being vulnerable and open. So all of these combined together with the greeting of shaking a hand when you walk in the door, hey, how was your day and how's it been since last week? All of these little things together coincide with the therapist reading and noticing what's happening. Then they ask themselves, what's the real issue here, right? Is it just what they've told me? They're coming in here and they're saying they're upset, they're mourning for somebody, maybe a divorce or somebody who's passed away. But is that really the reason why? After all, there might be something deeper at play. Or it could be a myriad of other things, but it's clinical for them to get and use their skill to get to the bottom of what is the real issue here. For if you self-diagnose it, you come in, if you know what it is, and if all they can give you is go, yep, you're right, it's that issue. This is why you're here. So therefore you need to do all of these exercises or all of these techniques or strategies in order to improve. That's great. But if they can find out that there's a deeper layer between what you think is going on and what brought you to the therapist in the first place, and indeed what it is, the real pinnacle of the problem, when you get that clarity, that's the aha moment for you, and you might think differently about the whole situation, and there's self-healing even from one session to the next for you. The therapist is also thinking, for sure, without a doubt, how can I best support this person right now? Look, there's lots of different therapies out there, psychological, psychiatric, and so on. Many of them take a lot of time, but it's like peeling an onion, that they think there's one thing at play here. They're only going off what you said to them when you've come into them in the first place in the consultation. And by working through and seeing what's underneath each layer, they're beginning to realize there's another layer there, another layer, and that's where there is a consistent approach, perhaps once a week or whatever, where they need to have a sustainable visit or client therapist relationship to communicate, to use talk, therapy and other means in order to get to the bottom of what the problem is, and then to try and heal it and try and help you move on in the future. You can't change the trauma of the past, but you can try to change how you react to things in the future. Now, therapy might go on a long time, but it's not truly the best supportive thing for the therapist to do. Yes, they may be running a business, but they also want success for you. And if you can get as much success and awareness right now, then surely you're going to be the best form of advertisement for them to get extra clients, and you'll speak very glowingly and say, hey, look, I only had a couple of sessions. I wasn't there for 2 years or anything like that. And so a couple of sessions, people just perceive, well, you're not too bad, but things went on well, and you're happy to be vulnerable enough to talk about it and refer this person. Yes, indeed. Look, therapies out there, therapists out there, we all know, even people, that there are so many people that need therapy, that need extra work. They might also, and are certainly thinking within the realm of, are we making progress? They don't want to waste your money. There's no point them having, say, 10 clients over 2 years and once a week they're full. Cool. But then these sessions, even though they take a long time and they're going through a couple of sessions a day, and it's pulling them back, maybe making them feel burnt out, but they're getting paid and they're paying the bills and they're making money. Like, they don't have room maybe to have more clients or take more clients on. Such is the gravity of your problems. And then not everybody is successful with therapy. And so with that, the bad, like, word of mouth goes out there. People are not going to refer. So it's better for them to have a rich turnover of people and to get to the issue quickly, and so that you're not wasting money and the progress is being made currently, like literally session to session. Now, there's no doubt about it, you probably will, if you're going to a therapist, or indeed if you are a therapist, agree that there's one session, perhaps earlier on in the therapy, that there's a real breaking through, a real awareness, a real, this is what my problem is. Oh my gosh, this is how I go out there and attack it and change my world. And that's wonderful. Maybe you will not get as many and often as many sessions like that where there is such a big change, and you kind of go, do I really need to book for a year in advance and so on, or every Tuesday at 5 p.m. when I don't think I need it anymore. So that's what can happen if they don't make progress currently. How does this connect to the past session? There has to be a weave going on from one session to the next, a flow, a graduation of, we got to the first point of the weakness, in other words, what it was, the real trauma for you, how you processed that, how you rejected the good feelings of healing, say, or how it affected you, and what was the worst person or the specific thing in that whole process that affected you. Now we've got to that. Now we need to make it stitch from session to session, so that there is progress here, that we're not skipping sessions or skipping weeks and we're falling behind. It's becoming inconsistent. We're forgetting the feelings and we are trying to push back on it and bury it in the past. They want to connect things so that we in the future will be able to memorize, unfortunately, some of the healing, the pain that hopefully is the last time and the most intense time that maybe since the actual specific moment of pain or trauma that they'll feel it. And if they can do that, that is going to help longer term in the healing process too. The truth is, not every client is going to be honest. So they have to ask themselves, what is this client holding back? Can we get a little bit further and deeper here without causing too much of a delay, without saying, oh, I need more money, I need extra sessions here, even for a couple of weeks. But it's pivotal to their work as a therapist to make sure that they get the right memory or the right experience so that they can build from there. Therapists, and certainly good therapists, notice when you or a person that you know maybe that needs therapy avoids topics or downplays emotions, and they are looking for a deeper explanation. They might even kind of push off most of the session and think to themselves, no, I have to do my own homework here. Try to find out another strategy to get to the real truth here. I'm going backwards for maybe a week or two or a session or two, but I'll be going forward very quickly after that because I really have to do my homework on this. Then there's a relationship. Look, it's great to have great rapport with the therapist. In fact, that's perhaps why you've gone to them in the first place. Somebody has referred you, said, look, you get on with them, they'll work on you, you're male, they're the same age group or whatever else. But when is too much like of a relationship too good or not good enough? How is our therapeutic relationship affecting the progress? Because at the end of it all, it's about ideally making progress, healing, and going out the other side. You don't have to ever meet the therapist again. If that is the most important thing, as in the progress, which it is in the first place, we don't want to lean on them. How can I challenge this thought without damaging or shutting down the client? This is what they're thinking. The therapist is wondering, if you express, say, harmful or limiting beliefs, how can I make you rethink them, reframe them in a different way without harming? I'm trying to get to the story, to the experience, but not to what's going to then make you feel like going through that same damaging process that has got you here in the first place. I don't want to re-traumatize you effectively. So they're also thinking, Are there any signs of deeper mental health issues like PTSD, red flags as such, personality disorders, hereditary diseases, the body and the mind is not at ease? All of these combined are the things in no particular order and sequence that are going through your therapist's mind. Most of all, what should be going through your mind if you're considering a therapist is to get one that's qualified, certified, and medically thought of in a very good light. If you're in doubt, go to your local medical GP or somebody that can help you in that regard that's qualified. Please do, though, know that I'm thankful for your presence today and I wish you well. Please do. Again, watch more.